Good morning, everyone. My name is Emily Ricci, and I am the Deputy Commissioner in the Department of Health, and I want to welcome you all to our Impact Series focusing on sparking technology and innovation. I'm going to wait just a minute or two to let everyone else join the Zoom room. We've got a number of participants online. I hope wherever you are at in the state, you are enjoying the sunshine that we are getting here in Anchorage. Although I hear in Juneau, you might be up for more snow. And for that, I deeply apologize. Okay, I think we're ready to move to the next slide. So if you are confused about where you're at, today you are joining the State of Alaska Department of Health as we talk about one of the next initiatives within our Rural Health Transformation Program Impact Series. So if you joined us for other initiatives, you'll be familiar with the format, but today our Impact Series will focus on sparking technology and innovation. I know it's something you've heard us talk about a lot. Hopefully it's something that you're thinking a lot about. And I'm excited to join Dr. Lisa Rabinowitz and Dr. Ann Zink today as we spend some more time diving into this series. Can we move to the next slide, please? So today's agenda, you've already gotten halfway through the welcome. I'm going to try to keep it brief so that we can hear more from the doctors and from you and less from me. But we're going to spend time talking a little bit about what is the Rural Health Transformation Program. That's what that RHTP stands for. What is this Impact Series? What are we hoping to gain from this? What is an overview? And specifically, as we think about this initiative focused on sparking technology and innovation, what does that mean? What does that mean for Alaska? What does that mean for your practice or the patients you help or the way that you seek care within the state? And then we want to do a quick wrap up and think about what comes next. Next slide. So with that, I would like to introduce our panelists. I gave you a sneak peek already. And again, if you've been participating in any of these other series, you're familiar with them. My name is Emily Ricci, and I work here in the Department of Health, specifically focusing on Medicaid, but as we know, that touches everything or many things. We're also joined today by Dr. Ann Zink, who I don't even know if I need to introduce to those of you who live in Alaska, but she's an emergency medicine physician. She runs Zinkwise Consulting. She's also a fellow at the Yale School of Public Health. We also have Dr. Lisa Rabinowitz, who's an emergency medicine physician and is also part of RABZ Partners. So we're very fortunate to have their expertise here with us today. And with that, we can move to the next slide. And I think I am just going to pass it over to them. Thank you, Dr. Zink and Dr. Rabinowitz.
Thank you so much, Deputy Commissioner Ricci and the whole DOH team for creating this space so we can explore technology today. We need to get our spark on. We're really excited to come together again today to find ways to innovate and partner as we envision real impacts in rural health systems in Alaska. And we really want to focus on technology so we can envision a broader and more proactive system as we move forward. So thanks again to all of you for joining us. If you joined some of our sessions last week, some of this will be repeat information as we kind of just get some groundwork laid to start these impact sessions. So a lot of this, as Deputy Commissioner Ricci mentioned, is really about connecting and forming collaboration. So during this series, we want to make sure that it's very interactive. Really, the key is to find ways to partner together. So introduce yourself in the chat. Share some details about yourself, your organization, what aspects your group hopes to advance with rural health funding, and don't be shy. Put your email, your telephone number if you're comfortable with that so people can collaborate and reach out to you both in the webinar and outside the webinar as we continue to build this series. And next slide. So the Department of Health has worked hard to create a very transparent process with the Rural Health Transformation Fund and has many helpful resources. So we encourage you to check out the website, which really has a ton of great information. There's also office hours really for technical assistance around the application process itself. And then stay tuned for dates for the in-person regional planning meetings. And that will help us gather community input on the unique needs for health innovations for those regions. And last week we started the impact sessions, which some of you were able to join. And again, these are designed to explore the 6 initiatives or focus areas that Department of Health has identified after feedback from all of you and the communities that provide a forum for collaboration and exploration of these big sky ideas. How do we connect our state? How can we do a better job of innovating in our health systems? And next slide. So these impact sessions are really a series of monthly sessions organized around those 6 focus areas. Again, meant to be interactive. It's a forum driven by the state priorities and also participant recommendations. So again, let's make a robust chat conversation. It's important to note that your organization or project may bridge across many of these 6 focus areas, so encouraging you to attend multiple different sessions. And we'll use this time to exchange ideas, lessons learned, including ideas that don't work or need to be kind of reworked as we move through the 5-year process. And the other thing is we want to welcome feedback. So if you've been to sessions, things that worked, things that didn't work at the end of this one, feel free to give us some feedback because this is really time for all of you and we want to make sure it's worthwhile time. And next slide. The other thing before we move on to this slide is just reminding people of what this isn't. And Dr. Zink and I have no stake or role in selecting these projects. So we really don't want to use this time for kind of promoting your projects. It's really to find ways to collaborate and innovate together. So just a reminder that we want to keep it outside the scope of kind of promoting your project. But it is about connecting. And that includes both tech experts and vendors, which are going to be a key component to sparking technology that can really add expertise to your project. Fostering collaborative learning and information exchange, building a shared vision for transformation, which is really the key, and then sparking innovative thinking. And we all know the value of learning from projects that ultimately don't work and need to be recalibrated. And often that ends up improving the project overall. And Department of Health, the Rural Transformation Fund has really built a system for this so we can use time to strategize in these phases over the next 5 years to build for a plan for success. And then identify and promoting partnerships, which really will help us broaden these systems and innovative thinking as we move forward. And next slide. And I'm going to turn this over to Dr. Zink to kind of level set us on the Rural Health Transformation Program.
Good morning. Good morning. It's so great to see so many names in the chat box. There's a robust list there. The team is working on collecting those, but as Dr. Rabinowitz had also said, use this as a time to connect. We know that technology is not going to hold the hands of a dying loved one, or they're not going to be able to walk that patient inside, maybe not quite yet. But it is critical for finding out, what those records looked like. And we have the opportunity to learn from others, but we really want to make sure that solutions are Alaska driven. And so really excited by it. But understanding what these funds are or are not will continue to help us to put this into context. So as many of you know, this was a one-time funding that came out as a $50 billion release. However, even in statute from CMS, it says that there has to be yearly increments in that. So every year, there's an additional $1 billion that goes out to states, depending on a whole series of metrics. Alaska, to their credit, 56 days, did an amazing job submitting applications. That really focused on you all, what makes sense for Alaska, and really excited to think with you all on what this looks like in year 1, as well as years 2, 3, 4, and 5 as we iterate together. And Alaska was able to receive $272 million to be allocated between January and October and are hard at work at that. But again, as we're kind of in that first year, thinking about future years, and that really gets us to the next slide. So go ahead and switch to the next one. Again, I want to continue to emphasize that this is this iterative process year by year, which is very different than a lot of other grants. But this is how this was set up in federal statute to have this 1-year allocation, reassess. Something we've said on other ones is it's okay to change, to have failures along the way, to learn new collaborations, to be like, okay, I thought this was going to be the answer. This one tool was going to be the solution, but I learned that Fairbanks is doing this other one and Ketchikan's doing this other one. And so therefore, if we all use the same one, we'll be more effective together. So this is an opportunity for us to be building those conversations now, both in thinking about year one, but really importantly in thinking about 2, 3, 4, and 5. So that just as this series mentions, we have real meaningful impact to Alaskans by the end of year 5 and using each one of these dollars as effectively as possible. If you go to the next slide, highlighting just specifically what the vision and mission is. And I worked at the state, I loved that the mission of the Department of Health was the health, well-being, and self-sufficiency of every Alaskan. You could think about that in every way that you were applying a project. And so wanted to just continue to highlight the vision that the state had in these funds. And that's really making sure that every Alaskan has access to affordable care that helps to make them healthy. And so that's focusing on primary and preventative care close to home. We all know that it takes a long time to travel, or sometimes we can't. Make it easier to get mental health, specialty health, emergency, and long-term care services. Reducing barriers so providers can be patient focused. So really thinking about both that patient, but then also what's needed from a provider standpoint. And I think this is a component where technology can either be an incredible hindrance. I joke in the emergency department, it's 5 clicks to crazy, or this can be incredibly supportive. And I have at the tip of my fingers what those 2 white pills that you're taking are. So how can we really thinking also about the provider experience and making sure that we're using technology to empower that close connection and that human relationship between providers and patients? And then that gets really into supporting that workforce. So what's needed to support our workforce? Am I able to have someone telehealth come in and help to support my clinical decision making in the emergency department? Or maybe it's upskilling and training. And so technology can be used in this ways. I know we're all incorporating technology more into our everyday clinical use. And then thinking what ways innovative systems and technologies can help teams work together to develop high quality care. And so what does it look like to really, again, be patient centric and not thinking about how do we ask patients to work for systems, but how do we make these systems truly work for the patients and providers who are in the heart of what is happening. Going on to the next slide. Again, really think about this overall bucket that Alaska kind of put all of their effort and where there'll be funding. And so they said they had 3 major goals: promoting the lifelong health well-being for rural, remote, and frontier Alaska. And in many of these categories, that includes every Alaskan. Building sustainable outcomes and driving workforce and technology. And so you can see again that blue little box. We're on that box here today, and that's where we're going to be diving in next, talking specifically about that. But I also like to think about goals 2 and 3 really supporting goals 1. So how are we really thinking about the workforce and technology, sustainability, and paying for value that's supporting people via healthcare access, healthy beginnings, healthy communities as a whole? So really excited to dive deeper. And this week's sessions focus a lot on kind of these second ones, including pay for value, healthcare access, as well as sparking technology. And today is on sparking technology. So with that, I'm going to hand it over to Dr. Rabinowitz to dive on in.
Okay, so let's change directions a little bit and start discussing technology. And let's make it a little bit fun, because technology doesn't always evoke fun for us. But really, the Spark Technology and Innovation, is an initiative that harnesses data and technology to enable rural, remote, and frontier, as Dr. Zink mentioned, providers to deliver secure, efficient, high-quality care, but it needs to be proactive and continuous and provide a better experience for both the patient and the providers. And that's really what we're hoping to move towards today. Here are the approaches that the state laid out for this initiative, and it's really expanding the use of consumer wearables and digital devices with provider training and technical support, increasing telehealth, appropriate AI, and cybersecurity through improved IT and remote monitoring. Facilitating data sharing and system interoperability by upgrading electronic health records, supporting statewide health information exchange, advancing workforce training and workflow design, and testing new delivery modalities using emerging technologies like unmanned aerial systems and kiosks. So lots to talk about today. If we go to the next slide, I want to spend a few minutes on just doing some definitions, so we're all kind of speaking the same language as this series moves forward. So give me a minute to just run through these. And so AI-powered clinical tools, really, these are the tools used in the clinical setting that automate, enhance, or assist in the provision of care. So thinking ambient AI scribes that are listening to your conversation with a patient and able to start generating a note, tools that help analyze your x-rays or diagnostic information, or ones that help providers make treatment decision, go through the algorithms. Cybersecurity, this is an important aspect, protections that keep the patient data and health system secure, private, and reliable, especially as everything becomes more digital and connected. Data systems, these are the systems that are used to document and store patient data and operational information. This is your electronic health record. This is your patient portal where you're communicating. And then health information exchange, you're going to hear a lot about that today. It's a secure system that allows that health information to be shared electronically across providers and settings using a common format and process. So clinics and hospitals can communicate and get the information they need to continue taking care of a patient. Interoperability, that's really the ability of these different IT systems and tools to exchange information seamlessly. Remote monitoring, that's a type of telehealth in which the healthcare providers are monitoring patients outside the traditional care settings. So using digital medical devices like blood pressure monitors, pulse oximeters. Telehealth or virtual care is really when healthcare is delivered remotely. And then wearables, which are a little different than remote monitoring. That's an electronic device worn by an individual that continually tracks physiologic information. So think blood sugar monitors, wearing a smartwatch with your heart EKG on it. This information may or may not be shared with the providers. So these are some just basic definitions as we kind of move through our discussion today. And we can move to the next slide. And I'm going to turn this back to Anne, and she can put on her State of Alaska hat and kind of get up to speed on where we're at right now.
Yeah, so now we get to dive in a little bit. So each of these intro sessions, kind of again, the overall view, sparking technology, now diving in a bit more. Just a reminder that what you're putting in the chat box, the team at DOH is helping to collect, and then we're working on making that publicly available. As in the other times, that chat box goes faster than anyone can keep up with, and we get it. So we appreciate people putting stuff in, and we are working on collecting that and sharing that back out so that you have the opportunity to do it. So what is working today and what can we move forward? I mean, there are some, and there's a lot of people on this who have made so many of these things. So particularly the tribal system, amazing use of telehealth. I think of store and forward information that's being done, looking in a little kiddo's ears and being able to send it to an ENT and getting feedback on exactly what that looks like. The state of Alaska led the entire nation on thinking about how to deal with intracranial hemorrhages or head bleeds, so that we didn't have to transfer every patient to an ICU, but thinking about who really could stay in community and who it was okay to transfer or was really important to transfer. But a key component of that was making sure that we could share CT images to have a better sense of what that was, and being able to have clinicians. So now many states are copying Alaska in that space. So continuing to lead forward in the ways that we're thinking patient-centered and not always having to take patients out of their community. Telehealth infrastructure, again, both what happens within the tribal and then the non-tribal system. It was not long ago that when I was working at Matsu, we had one neurologist when he was on call could help us with a stroke, and now regularly consulting with neurologists in real time on being able to care for patients in a variety of ways and being able to maximize the support and care that we do. I know this is kind of technical. Not everyone's in this weeds, but man, I spent a lot of time in the data. We do have one health information exchange. We're not California trying to connect multiple health information exchanges. So we got that going for us with a strong technology vendor and a very Alaska-centric kind of board and inference. They're on the call right now. So just shout out to the health information exchange. But thinking about like what we want more from them. Sorry, guys, but how can we do this better? How can we make the technology infrastructure that's already there move forward? And then what are the policy and programmatic technologically enabled coordination that happens? So I'm going to call out, we've called out Fresh Start a few times. I'm going to call them out again. But the Division of Public Health made it so that every Alaskan, regardless of where they're at or if they had access to Wi-Fi, could have access to weight loss information, being able to help with diabetes and hypertension control, and being able to use remote monitoring as well as community support. So how can we build and braid on things like that? So there's a lot of things we've already done. But we know that there's a lot of challenges. We have connectivity issues, things like I mentioned, the store and forward. when we're at fish camp, we don't always have access to our technology and being able to connect. So, to the tech vendors on here, we like to say Alaska is different. Alaska is really different. And so, making sure that what the technology tools are is going to have to work in this state for the state to be able to support it. Satellite internet capability remains limited. Sometimes the ability to send large images and files is incredibly limited. So, like the CT scan results are just highlighting that. And then the infrastructure and interoperability gaps. We've got amazing systems up here, but we know we have one HCA hospital and one CHS hospital and a series of Providence hospitals and a series of tribal hospitals and a series of local governance hospitals that all have their local governance. So we might have some idea of like what exactly we want to do, but there can be some real challenges in that. We have 92 entities concurrently participating in the HIE, but what ways that can happen. But according to statute, they can't share public health information or population health. So, is that something we want to change as a statute to be able to make that more available so that community can be able to be involved or not? And what does that look like? So, our statute is somewhat limiting on the ability to do that. Behavioral health electronic data is oftentimes separate, both because of history within Alaska as well as some initial federal components. And so thinking about, again, what is the information that most needs to be shared? What ways can we do it? Well, we're having really strong safeguards on privacy and protection. I've kind of highlighted these kind of tribal and non-tribal differences and similarities, and again, really focusing on how can we serve people so that tribal elder shows up at Providence Hospital System, and they have, say, like a do not resuscitate on their record, and they want it that physician seeing that patient would know that information and can respect their wishes. So how do we make sure these systems are crossing? And state licensure can sometimes be a barrier as well. So moving on to the next slide as a whole. Wanted to emphasize this kind of hits on what Dr. Rabinowitz talked about. There's a lot of different potential uses for this. I know many of you are already doing this and thinking about the ways, everything from data analytics to community-based, navigation and app systems, consumer-facing tools, remote patient monitoring, things like that can make a huge difference, or communication by providers. I'm seeing some of that in the chat box as well. So now we get on to some of my favorite slides. So going to the next slide, this is an opportunity. Go ahead and switch to the next slide. There we go. So this session is an overview, and we're going to bring you all in to kind of help share some thoughts and perspectives, particularly those Alaskans who are kind of sharing like what they're thinking really needs to be done so that we can kind of help connect them to tech vendors and or connect with each other on what that specifically looks like. But in our future sessions, we'll be doing deeper dives into specific topics. So we're going to go ahead and launch a poll, and you all get to weigh in here specifically on what you think is most important or not a priority at all. So you've got choices: not a priority, somewhat a priority, or extremely important. And this will help to focus our future sessions. So take a few minutes, go ahead and let us know. Do you think AI-powered clinical tools are the end-all be-all? Or man, we just got to make the HIE be the thing that runs and connects it all? What is your perception of the things that are most important as a priority? Because if everything's a priority, nothing's a priority. This helps us to be able to make sure this is impactful. So we'll give you a few minutes to be able to think about that, to look through that. And to Julie and team, I will let you release the poll once you see the number starting to come in. And I do also, while people are putting it in, I see a couple questions in the Q&A separate from the chat box. And if our team can immediately provide an answer, we're providing an answer there as well. Others are more theoretical questions that we'll try to address in the conversation as well. So I'm looking forward to that. So again, there is a poll in front of you to choose your ranking. There's a chance for other as well. Kudos to Alaska for making this a very Alaskan-facing and very involved process. Again, I'm working with other states to think about rural health transformation, and this is not the way it's done in all the states. So I just really appreciate Alaskans helping to create the solutions that we want to see moving forward. Okay, how's that poll? Oh, here we go. It's always a surprise. I never know. Okay. Interesting. It's always fun to see what these look like. Okay, so we have a couple strong winners in thinking about support. So technology to support providers comes up really as a strong one. Telehealth access. I appreciate people bringing that up. I think sometimes people have this perception that Alaska has got amazing telehealth access, which isn't always the case. Data quality, access, and analytics comes up really high. If you have something that in the other, feel free to put it in the chat box so that we can kind of see what we might be missing in that space. Other is always going to be small because that, consumer tools is on there, but not ranked quite as high in these apps to schedule. But nothing came off as like not important at all, and lots came up as important. So, um, and Julie saying responses are still rolling in, so might have some good thinkers in there. So totally appreciate it. I know some people do have to drop off. These are recorded. If you need to, we'll continue to see these kind of coming in and watching, and we will help to direct the next conversations based on those. So with that, I'm going to hand it back over to Lisa, Dr. Rubinowitz.
Perfect. And we can move to the next slide. So in order to get this conversation going, we're going to go through a quick vignette and then really encouraging people to kind of share their thoughts in the chat. So Tom is age 62. He's a retired oil field maintenance technician who lives in Fort Yukon, north of the Arctic Circle, where access to care is limited by distance and weather. Managing his diabetes and heart disease, Tom visits the local clinic sporadically, and changes in his condition often go unnoticed until symptoms become severe. These delays result in requiring emergency air transport to Fairbanks, disrupting his life and increasing health risks. And next slide. So I'd love to hear people's thoughts on what role technology could play in creating a better transformed health system care system for Tom. So how can we make Tom's experience better? How can we keep him healthier? And what would be different for Tom, his family, caregivers, providers, and community with these changes? So please, if people can start putting some ideas in the chat on how we can change the system for Tom using technology and innovation. And feel free to also raise your hand and we'll ask you to come off chat when you do that.
And
So we
specifically, we're
have,
looking for Alaskans to kind of share their perspective on that space. So I am putting in the chat, if you are a tech vendor, the information here is going to be captured. We look forward to you to be able to capture in other ways. And then as we dive deeper into the sessions, there'll be more of kind of a town hall on kind of specific topics where there will be more interaction with each other. So just wanted to highlight that. Sorry, Dr. Rubinowitz.
no, that's great. So we have one person with their hand raised, Brian DeHai. So go ahead and come off mute and share your thoughts with us.
Sounds great. Can you hear me okay?
Yes.
I would say Tom needs a couple of different things. One, Tom needs chronic medicine care in his location that allows him to continue his daily activities and be able to manage his chronic diseases in place. Which, to your point earlier, can be easier said than done. And the second thing that can be easier said than done is Tom needs access to medication or medication adjustments in place to manage his chronic disease, if we actually looked at this as a chronic disease rather than an acute disease. And
Yeah,
that can be done through telemedicine on an outpatient basis, through specialty clinic, and then also we'll call it in an acute or semi-acute phase through medication adjustments.
Yeah, I think those are absolutely things that Tom needs. I think as we think about medications, especially in rural Alaska, again, our geographic challenges do make acute medication changes difficult. So I think that's another aspect to this that we need to start thinking about how technology can help us. I think there's some other great comments in the chat. Dr. Zink, I'm seeing a lot of remote monitoring and how that could help with Tom being on top of his medical issues. And someone, Annie's putting in here, using drone technology to help with the medications, and that's one thing that many states have already started doing. Um, I think communication between his providers, his local clinics, provide another opportunity. And Dr. Zink, what other things are you seeing in the chat that could help Tom?
Yeah, no, I'm seeing lots of great things. I wanted to raise up the comment of having good access to nutrition. And we know that access to good food and food sources can be really challenging within the state, particularly in the way that some other federal laws are set up on the way that people have access to food. So I would highlight technology to also be technology to action. So if we're seeing gaps in the infrastructure for food, how can that help to support healthy communities? So we can think about, access to fresh food. We know that this is a huge challenge across a lot of our state, or culturally relevant food that can also make a big thing. So I just wanted to highlight that, like not as only to solve Tom, but to solve the Toms of the world and create action in that size. For those interested in drone technology stuff, I would highlight UAF is kind of a national leader in thinking about this technology. So feel free to touch base with the UAF team on what's happening there. So there's many things that are already going on there. And then, a common theme that we're seeing across a lot of these, and I'm not surprised for a second, is the importance of coordination. So that might be coordinating from, doctors, physicians, nurses talking to each other. And we see things like, technology like Tiger Text just got put in there, or electronic pharmacy cabinets, to being able to like think about what ways you can be able to track those additional meds that are being given and not be able to think about what has to be moved and shared. So just highlighting that coordination piece. Remember, in the first year, there can be like a planning component of it where maybe year 3, 4, or 5 is thinking about. So, as maybe finding the others in your ecosystem who are solving for Tom across all of these sections, if that's a component of what you are really focused on and doing, and then thinking about how to build that out over a couple years so that we are getting dollars out, making dollars for action, and then at the end of 5 years having impact. But back to you, Dr. Rabinowitz.
Yeah, we've got a few more people with their hand raised. I'm going to have Paul come off mute and share his comments.
Hi. One of the great things is some of these problems have already been solved, and I'm going to direct your attention to the VA, which has, I could say, not even arguably the best RPM program in the world. And one of the components they have is what's called a disease management protocol, which provides patient education on morbidities, but it also provides the means to collect subjective feedback for those vitals which, can't be measured with a device. So the VA has done a phenomenal job of doing this for people who literally live off the grid. So we can look to them as a model of how it can be done.
Yeah, no, I appreciate that, Paul. And I think, how can we take a model that's already working and broaden it across the state? And so when Tom has to come into an urban center for care, this system moves with him and is able to track his health information and share that. So I appreciate that comment. Another interesting comment in the chat that hasn't come up previously is using simulation labs and kind of using that technology to bolster our expertise and workforce in rural Alaska. And I appreciate that comment as something we hadn't seen in the chat previously. I know that UAA, through their College of Health, is doing a lot of work with the sim lab. So I think there's some interesting opportunity there. And then I'm going to ask Brandon to come off mute and share his comments.
Yeah, hello everybody. I kind of to tag in with the VA comment. I work with Alaska Provider Network up here, and it's really cool because I think there's technologies that we've already have been deployed in Alaska, that I think we can build on and partner. Like you guys have been such a good job with pushing to say, hey, like let's partner and get some of these groups together. We've already deployed remote patient monitoring, chronic care management technology in the valley, extending all the way out to Glen Allen, north of Talkeetna, using whether it's Wi-Fi signals or even Starlink satellite technology to connect these patients back to their primary care clinic One of the things that's really cool that I don't think we that technically I think I promoted enough is Alaska was the first state and the Valley was the first really area in the nation where we've deployed an AI bot, basically caregiver to support RPM CCM technology in rural areas. We were the first ones in the nation to deploy that. And we pulled it back in, integrated it in with the EMR to be able to say for Tom's diagnosis, if his monitoring would alert to a higher level, it automatically alerts in the patient's chart at their clinic. So it's really combining a whole lot of technologies that we've already deployed that are extremely cool. And when you talk to the providers, I've talked to a couple of them at Capstone, and they've already said through this RPM technology that we've probably saved 4 or 5 heart attacks from just that early intervention. So I just think the way this is going is amazing, and there's so many cool things that we're doing, and I'm excited to see how we can just grow it.
I kind of wanted to build on your comment, Brandon, and some of the other last comments about like the VA. So, we didn't tell you about Tom's insurance status, but what I experience a lot, and Brandon, thanks for the shout out to the Valley, but like Tom might be an Alaska native. He might be a VA beneficiary. He might live, let's put him in Matsu, since we were just talking about Matsu as a whole. And so in the population health world, the VA is managing their patients. The tribal health system is managing their patients. And Matsu Regional is a private hospital that he's just close to. And then maybe he also has Medicaid and Medicare. Maybe he is dual eligible from that perspective as well, who are also their patient populations. But those systems don't oftentimes talk to each other on what does that look like for care coordination. I think about a lot of the care coordination that happens across the state, and oftentimes people have, 4 to 6 different care coordinators or different technology services that are trying to support them. And if that's their one, that's great. But how do we make sure we connect them? I think that's one of the real challenges in rural health is that oftentimes the patient population is very varied or may have multiple. For the vendors on here, Alaska has the highest per capita veterans. It also has the highest per capita active military. And we have 226 federally recognized tribes. And all of these have kind of their own health systems. And so finding ways to really be able to be patient focused and connect them, is not in other conversations across other states. Sometimes those are add on if can be. I would say that in Alaska, that is an absolute must in thinking about the ways that patients get access to care. But back over to you, Dr. Rabinowitz.
Yeah, perfect. And again, in encouraging people to raise their hand and chime in, we'd love to have more people commenting. And we could go to the next slide. We're going to kind of work through this vignette. So imagine we've done all this great work that we're talking about, and Tom is now using remote patient monitoring tools, tracking his blood sugar, his blood pressure, weight from home, helping manage his diabetes. His care team reviews his data regularly, and a local community health worker checks in when early warning signs appear. Treatment adjustments are made promptly through his telehealth consultation, preventing his complications. With consistent monitoring and support, Tom avoids emergency transport, manages his conditions confidently, and remains active in his community. If Tom goes to the hospital outside his community, his medical records transfer there as well. So this is now looking a lot better for Tom. How do we get here? So next slide. Where would changes need to be made across Alaska health system to achieve this vision? So not just for Tom, but how can we think broader? How can we make changes across the whole system? What initiatives or projects would help to achieve this transformation? And again, what partnerships would need to exist? And we're kind of thinking broader now on this slide. So moving past Tom, moving past Fort Yukon, but moving broadly to the state. So let's get some ideas rolling in on that. So I think Sanjay just put in here, interoperability between systems is a national priority. So definitely interoperability, we've seen time and time again, hamper innovation, even in Alaska. So when electronic health records came out, we thought, as Dr. Zink and I, as practicing emergency physicians, we thought this was going to solve everything and we would be able to see what was happening with our patients. But the interoperability really kept that from happening. And so as we look at HIE, as we look at moving forward, we really need interoperability between small clinics, between hospitals, between our medication drones, between our telehealth. This all needs to interconnect to make it workable, especially if we're looking at the entire health system of Alaska.
And Dr. Rabinowitz,
Yeah.
I'll just kind of, in highlighting that, I see some chats coming in about like thinking about the systems. I want to emphasize that part of how Department of Health is thinking about like pay for value is in sustainability on these efforts. And your project, we forgot to mention this earlier. Your project may fit well within this, or it may fit within other changes to payment models and systems that could be built into kind of efforts going forward. So I guess I just want to highlight that like the Rural Health Transformation Project is amazing and there's huge opportunities, but it's not going to be the end all be all for all healthcare change forever. And so what ways do we build the lessons learned, the opportunities here into other health transformation efforts so that we're thinking about payers, we're thinking about people, we're thinking about access to food, we're thinking about communities as a whole. So I want to continue to hold that and appreciate the Department of Health continuing to listen. And legislators are on here, others on thinking about what needs to change so that we're thinking about the whole system of health. But back to you, Dr. Rabinowitz.
No, that's perfect. And a good segue to Jonathan. Go ahead and come off mute and share your thoughts on transformation.
Oh, great. Well, thank you so much for choosing me. So I'm in Kodiak, Alaska, and in the social element of healthcare, I'm not a clinical person. I started out as a drug and alcohol counselor when I came to Kodiak, and then got into Medicaid care coordination, and then now I have a home and community-based service agency and do those services on Kodiak. And that layer of healthcare, in my opinion, the social service layer, the care coordinator, case management layer, the person that would have been helping Tom with all of this, helping him with his records, right? Like the actual paper stuff, taking him places as far as not physically, but like helping him with his records and coaching him through this. The me, like the person that was me, the care coordinator that Tom had access to back before, I think it's been getting more difficult. And you're right, there's so many patients that are dually eligible in rural Alaska for different things. I see what changes that need to be made is digital literacy for Tom, for the patient. There are so many great tools for us providers, right? Because usually we got the checkbook, we could pay for it. But the tools that I want to see built focus on Tom specifically, like giving him empowering him with the digital literacy to manage his own health care. These are intelligent agents. I was at the NVIDIA conference a couple weeks ago, and I just did an AI health conference at Stanford last week. It's like the technology's there. Tom can have his own intelligent medical agent that knows his EHRs. Yes, well, that's not everything. Cultural in Alaska, there's a rich oral history. Okay. So what I envision is a model, an intelligent model agent that Tom has that knows his whole health history from a cultural perspective. And then the EHRs are just, added on to that and not the authoritative health data. And so what the initiatives and projects that I think can change this is Epic did a Cosmos type of research project where they grabbed all this data from like 300 million Americans, with the PHI out of it. And it's like a research project. What I would like to see is a rural health Cosmos type of project where we're not just pulling electronic health data that's already available, is that we're building relationships with people and we're interviewing them and we're getting a rich oral cultural history of their health. And then we could build a large language model and AI agents to help those specific people. We don't need to interview thousands, but I'll get off now. I'll talk all day. Thank you.
No, these are all great thoughts. I think in addition to digital literacy for the patient, I think we also need digital literacy for providers. And the more we're working with technology, especially in rural Alaska, and getting comfortable with it, and realizing that it will help our workflow and be able to spend more time with our patients, people will become more comfortable with that. So I think that's important. And Dr. Zink, you have a few other things you've seen in the chat that we want to highlight.
Yeah, it's kind of build off of, what was just said. I think there's a lot of comments about the human element and the importance of that. And do not wish to discourage that in any way. Really encourage people to come to the workforce one. I see comments about community health workers, people reaching out, cultural needs, and so highlighting that. I also would just highlight, and this goes a little bit onto Jonathan's point about there is data and then there's information. And so, as you mentioned, oral storytelling is a huge part of information. And thinking about the way that AI scribes are helping to like capture more story rather than just clicks and data boxes, how we can be able to sit on top of that, to be able to not just upskill patients in their digital literacy, but be able to listen loudly to what communities and individuals need. And I guess the last thing I would elevate up, both half as a question and half as a comment, is there is this interoperability component. But what do communities or families need in a data component to think about how to support Tom in this space? And so when I think about, again, like the HIE statute and what we can publicly share for a lot of this information, it has to be like within the care team. Is it important to us as Alaskans to think about having data and information that is de-identified more at a public level so that community or family can be more involved? Or do we really want to focus our time and effort on technology for like specifically Tom and his diabetes? So I think in Alaska, that's a unique question, both on a privacy aspect, but also on the importance of community aspect that I encourage us to continue to wrestle with as we move forward. Dr. Rabinowitz.
Yeah, no, that's great. I'm seeing some other kind of comments in the chart around security and making sure, whatever we innovate and implement, we need to make sure that there's good security checks on it. And I think as across the US, we're trying to navigate technology, how that interacts in our health systems. I think that has been a priority. Dr. Zink and I are both going to national, conferences on this, and I know it is a priority, but we need to, as a state, make sure that we're making the right choices for our population and making sure that it is safe and protected information. I think what Dr. Zink is talking about is really, can we use some of that information without patient identification to help us support these systems as we look to add things that can help support diabetes in rural Alaska or other challenges or gaps that we're seeing. Do we have anyone else who would like to come off chat and kind of talk about their thoughts on this? If you do, please raise your hand and we'd be happy to call on you. And I think with that, we'll see if Erin Walbrecker would like to talk a little bit about some of the comments in the chat. Erin, are you able to raise your hand and come off chat? Perfect.
Hey, can you hear me?
Yes.
Hey, what's going on, everybody? And it's nice to see Ann Zink in here too. I remember working with her when I was with the state. So yeah, just a couple just different ideas that I had. I mean, one of the first and foremost things, and looks like Zora already mentioned it in mine, is we have to have that reliable internet. I mean, you can have AI till you're blue in the face, but if you can't connect it to the back end, it's not going to work. So I would say we should try to make some kind of partnership with like Starlink or some kind of satellite internet company, at least, so we can have some kind of emergency responses. And along with that, if we're going to have, we have to make sure we have the actual employee infrastructure too. And I know that that's a bit of a touchy subject around certain areas hiring people, but we would need like your drone management, your AI employees. We would need the tech employees that actually know how to do like the coding. And I'm not just talking about like vibe coding, although I think that would be, at least something that you can experiment with to help the whole industry. Just a little idea of like the little Pixis. I don't know if there's like a lockbox or just like a medication lockbox or something that could potentially be used as an emergency dispensable, like in a tribal village, that you could potentially remotely unlock it or remotely dispense a life-saving medication to somebody in a village during a blizzard, for instance. Obviously, we would need quite a bit of research to say, okay, what's in this box? But I think that it certainly would help. management, obviously the healthcare informatics and gathering the data, gathering and processing the data. Obviously, just anytime we're going to be getting it, most of the stuff is probably going to be grant funded, I'm assuming. So we want to make sure that we actually get that quantitative data to fill those needs. But we also want to make sure that we collect both quantitative and qualitative data on this and process it all to make sure that we're actually doing something good, that we're actually helping and benefiting the Alaskan people. And then finally, not as a primary means, obviously. We don't want to just trust AI with everything, but the AI is getting really, really advanced out there. And I don't know if you've seen the story of it or not, but obviously this is a 1 in a million shot. But, some guy kept on telling his physician that he was sick and the physician wasn't buying it. And so he went to AI and the AI told him that he had this serious issue, and it wound up to be true. And this has been going on for like 3 or 4 years, this guy said. So just having some kind of an AI backend that could be used for just ideas, just to kind of as a collaborative partner, essentially, if in lieu of an actual like physician or in lieu of somebody, just so like a CHA could make a little bit more of an educated decision, especially in times of an emergency.
Yeah, and I think there's a lot of cross connection over these different initiatives. So workforce strengthening, you mentioned, and with that comes again getting our workforce comfortable using technology as a tool to help and check symptoms, do different aspects of AI that can help your practice without relying on it completely. Because as Dr. Zink keeps reminding us, it's really important to have that human touch, and that's what's important to the patient, to families. You need that connection, but yeah, there's that sweet spot in the middle that we can get to. The other thing I want to remind people is with this Rural Health Transformation Fund, broadband is not something that can fund. So although we all understand our internet can be spotty at best, especially in rural Alaska, the fund can't be used for broadband specifically. But I think as an initiative for the state and as we move forward with technology, we're going to have to bolster our broadband and our internet connectivity for sure. And go ahead, Ann.
Yeah, just highlighting kind of other things that were said and thinking about as we're thinking of years, 2, 3, 4, and 5, to Jacqueline's point, the implementation and sustainability are going to be really important in that space. But then also to the comment that was just there, we need to work in the world that is. And so we know that some areas do have internet, they may not have as robust. And there's some great questions about like Starlink. And there are, I think, some specific questions that the department can kind of help answer from a safety component. But, I just gave this presentation about like riding in my first Waymo car, and like the way that data and technology are changing around us so quickly, and how do we embrace those changes that are happening, but make sure that we're using these funds to be hyper focused on making sure every Alaskan has the opportunity to be healthy and well. So not always recreating, but really stepping into this rapidly changing data and technology space. Back to you, Dr. Rabinowitz.
Perfect. And we can move to the next slide as we start to wind down our hour here. So some examples, and we've touched on many of these already, talking about remote patient monitoring, deploying monitoring devices, talking about reducing emergency transports, and working on avoidable complications that we can help limit with remote monitoring. Provider-supported telehealth monitoring and early interventions. We have some robust programs already happening in Alaska, and Fresh Start has been mentioned already, but really working on supporting continuous care for residents, especially in our remote areas. Community-based digital care navigation and support tools. Again, we keep coming back to what do families and community needs, and are there different arms of the support that can happen, such as community health workers that can help the reach of providers? Integration of remote monitoring into the health information exchange. How do we make our HIE more robust? How do we make it have a bigger reach and more interoperability? And then technology-enabled chronic care management models, especially for rural seniors, as we do know that there's a gap for that. And so those are all important things. And next slide. So I'm going to send this back to Dr. Zink to kind of wrap up some of our themes that we've seen today as our time today is ending. But I'm impressed with all of the great ideas in the chat. So back to you, Dr. Zink.
Yeah, no, sounds good. I think one of the big things I see is how technology is critical. Many of you are here. Let's see here. We got 247 of you right now, being able to join. I have some come in other times and other places as well. But that it has to be integrated with the workforce, as we talked about, what else is happening in communities, how we're thinking about the sustainability. We can't just roll out a widget and expect it stays forever. None of us expect our iPhone or our, phone to be there forever. We know that it has to have system maintenance and on time, sometimes replacement. And the same is true with healthcare technology. So, thinking about how that it fits into the sustainability component as well as that pay for value are all critical components of it. But there are so many great questions too about like how do I connect? How do I learn from like what's happening in other states as an Alaskan trying to do better care coordination at home, and as a tech vendor saying like I got this thing that I think would be really helpful. How do I actually make this work? And being able to connect it, and then kind of what are some of the standards that we need? So with that, I'm going to turn it over to Deputy Commissioner Ricci to kind of summarize a little bit of her thoughts, feelings, and close us out. Deputy Commissioner. You're on mute
Would
though.
it help if I came off mute? Hi,
There you go.
everyone. And Dr. Rabinowitz, Dr. Zink, thank you so much for leading this discussion today. We have just a few more minutes left. So we're hearing a lot of questions, or I'm seeing a lot of questions about partnerships, right? If we have some of you are vendors with different types of technologies that you believe could help meet some of the needs you're seeing in the chat. We've had some questions about whether the department will help coordinate. How do we build partnerships? I think the forums that we have right now are one way to build partnerships. We are thinking about other ways that we can connect people more concretely and give everyone an opportunity within the community, again, to see what's out there and what exists, and to think about that in the context of how do they meet the needs within their community and within the patients that they serve. So Wendy, I see your question in the chat. We will circle up and get back to you on that. I think part of the work that Alaska Community Foundation is doing as they review the LOIs is identifying opportunities for alignment and partnerships that exist that an individuals submitting letters of interest may not be aware of. So more to come on that. And I think we have a few more slides, but I know we're running out of time. We're going to have more impact sessions coming up, focusing on communities, workforce, healthy beginnings, technology, again, healthcare access, and sustainability. So mark these on your calendar. I think we're through most of these, but we've still got one more coming up this afternoon, and we've got another one on April 1st. After that, we will be sharing schedules for some of the upcoming meetings as we move forward. And with 2 minutes left, I want to remind you all to stay informed and stay involved. You can use this QR code to go to our website and learn more about the Rural Health Transformation Program. There's a lot happening. So if you move to the next slide, there's a lot of different ways that you can get information. I would sign up for program updates. Again, I feel like every week we are rolling out 2 or 3 more announcements. We are trying to move fast and furious, but we also want to keep you informed. So sign up for program updates. Make sure you're getting information about what's happening. Also, if you have questions, you can email the email address here. It is doh.rhtf@alaska.gov. Here's my ask. We are a small state. Many of us know each other. I see a lot of familiar faces on this call, and I heard some familiar voices. Good afternoon or good morning, wherever you're at. I know you have my email address. You probably have Commissioner Hedberg's email address. If you have a question about RHTF, please use the general email, not because we don't want to hear from you, but because I think you'll get a faster response. And we want to make sure those responses are consistent. So if you have a question about this, please use the general email versus emailing individuals specifically. It will actually help get you a faster response. So with that, I just want to say thank you again to our panelists, and thank you to everyone on the call. We appreciate your time. There were some really cool things that we were thinking about today, and I look forward to connecting further on this. So thank you, Dr. Rabinowitz. Thank you, Dr. Zink. Have a great day, everyone.